for giving me this opportunity. Our study's title is Epithelial Ovarian Cancer and Real World Outcomes. Next slide, please. The main patients included in the study are the patients who underwent either surgery or at least received 2 cycles of chemotherapy at our center. And this study is coordinated between the departments of medical oncology, gynecology, and surgical oncology at our center. Next slide, please. Coming to the flow sheet, from January 2015 to August 2019, 435 patients were of ovarian cancer patients were enrolled, and among them 390 patients were epithelial ovarian cancer patients. The most important thing which we have to highlight here is among these patients, 15% of the patients, that is a very significant number of patients, have defaulted before starting the treatment or after receiving 1 cycle of chemotherapy. And at the end, 290 patients were included in the final analysis. Next slide, please. Most of the patients in this study are advanced stage ovarian cancer with 83%, and more than 40% of the patients presented with poor performance status of 2 or more. Next slide, please. Among the patients who received the treatment, only 75% of the patients have received the surgery. 25% of the patients didn't had surgery during the first line therapy. And among the patients who received the surgery, the optimal cytoreduction rate was around 50%. Most commonly used chemotherapy regimen is a combination of paclitaxel and carboplatin. And if you see among the patients who underwent surgery, there is about 10% difference in the optimal cytoreduction rate in the patients who received neoadjuvant chemotherapy. Next slide, please. You can see the median progression-free survival is 19 months and median OS is 39 months. It includes both stage 1, early stage and advanced stage ovarian cancer patients. Next slide, please. On multivariate analysis, the important factor which affected the progression-free survival and overall survival are the surgery, and along with surgery, stage has an effect on progression-free survival. And in the down, we can see an images which was in the images we can see a nice division of the curves between the patients who underwent surgery and who didn't had surgery in the progression-free survival and overall survival. Next slide, please. This table summarizes the important data about epithelial ovarian cancer from our country, which included patients of more than 100 participants. There is a lot of heterogeneity between the studies, between the patients who underwent surgery and the optimal cytoreduction rate. Despite of all these things, there is our progression-free survival and overall survival are similar to the Tata group studies, with which is about 19 months and 40 months of overall survival. The important outcomes which we have noted in this study is epithelial ovarian cancer is a very difficult to treat cancer in our setting, mainly because of the patients presenting with advanced stage and with poor performance status at the time of presentation. And another important factor which affects the outcome is the surgery. And in a real world setting, in our data, around 25% of the patient didn't receive surgery due to various reasons. Most of the reason is they are unfit for the surgery. Most common reason is, and this is the largest real world data from our country in newly diagnosed epithelial ovarian cancer patients. And another important finding which we found out is 15% of the patients are defaulted before starting the treatment. It is very important to improve the outcomes in our setting, and we are using different methods of social economic support groups to improve outcomes in our patients. We are using this real world data to improve the outcomes in our future patients which we are going to treat